Hello and welcome back to GP Video Podcast by Nadia. So we are continuing in this one again with PCOS. We just spoke about the diagnostic criteria of PCOS in our previous podcast, but I would just repeat it. This is a diagnosis of exclusion. It is the most common metabolic, reproductive, and endocrine disorder of reproductive age women. So anywhere between menarche and menopause. So this is the most common reproductive. Endocrine means hormonal, and metabolic disease or syndrome or a cluster of symptoms or a condition affecting women. 1 in 6 women in Australia should have or suffers from PCOS. Usually underdiagnosed as well, but 1 in 4 women in Aboriginal population suffer from PCOS. Okay, now what are the symptoms? So it is again a diagnosis of exclusion by, because it's a symptom complex, it's a symptom cluster, there are so many symptoms in it. We should, as GPs, make sure that, there is no other cause behind them by doing blood tests and scans. But once they are all done and none of the other causes are found, then how do we make a diagnosis of PCOS? We make diagnosis of PCOS based on Rotterdam criteria. A diagnosis is made if an adult meets 2 of the following 3 diagnostic criteria and other causes have been excluded. What are those 3 diagnostic criteria? Number 1 is menstrual disturbances, including secondary oligomenorrhea or amenorrhea. So there are 2 kinds of menstrual disturbances. One is the regularity of the cycle and one is the amount of menstruation. So either, it can be both extremes in PCOS. So either the cycle could be less than 21 days or more than 35 days or a combination of both. And the menstruation could be no menstruation at all, very scanty menstruation, or a lot of menstruation. So, but anything which is abnormal in menstruation it could be both the regularity of the cycle and the bleeding, or it could just be the regularity of the cycle, or it could just be the bleeding pattern. So any kind of disturbance in menstrual cycle is one of the features, is one of the cardinal features. Number 2 is clinical or biochemical hyperandrogenism. Hyperandrogenism means increased male hormone in the body of a female. So biochemical means we'll do free testosterone levels, and if they are high, that is pathognomonic. Otherwise, clinical features are like hirsutism, hair on the face, acne could be there, and also male pattern balding or alopecia. Like losing your hair. So that could all be the features of clinical hyperandrogenism. One of these, like if they are clinically present or biochemically present, or if they are both present, then that is another thing to endorse that this is PCOS. And number 3 is polycystic appearance of ovaries on ultrasound scan. So a transvaginal ultrasound scan, an internal ultrasound scan that shows 20 or more antral follicles in one of the ovaries, or one of the ovaries have volume of more than 10 ml or 10 cc, that is also one of the diagnostic criteria. So any one of them, menstrual disturbance, hyperandrogenism, and ultrasound scan. So for example, if a lady already has menstrual disturbance and hyperandrogenism, we don't even have to do an ultrasound scan because she's already meeting 2 criteria. So yeah, other features which are very strong features of PCOS but are not included in the diagnostic criteria are obesity, insulin resistance, because when you're obese, your body cells start becoming resistant to insulin to consume sugar, and then eventually you will develop type 2 diabetes. So obesity, insulin resistance, and subfertility. So women with PCOS have a lot of difficulty in conceiving usually. So see, it is reproductive. So it is it's including the fertility stuff. It is hormonal, so menstrual disturbances, and it is metabolic, so obesity, insulin. So a lot of systems, it's a multi-system disorder that we are dealing with here. Then it again says that an ultrasound scan is not required for the diagnosis of PCOS if an adult has both menstrual disturbance and clinical or biochemical hyperandrogenism. If only one of these features is present, a transvaginal ultrasound scan should be performed in the first half of the menstrual cycle, and a follicle count should be requested. So the GPs should mention on the referral that what are they looking for, and they really need a follicle count. PCOS can be diagnosed without ultrasound if an adult has both menstrual disturbance and clinical or biochemical hyperandrogenism. Okay, then we will come to approach to treating polycystic ovary syndrome in my next video. See you guys then.